If you are ADHD or autistic and you have ever struggled with joint pain, but doctors don't seem to be able to give you an answer as to where that joint pain is coming from, this might help. So hypermobility is an extremely common comorbidity with both ADHD and autism. Hypermobility in this case means joint laxity, and this typically comes from a difference in how our collagen is set up in our body. It makes our tendons and our ligaments stretchier than most people. Those are the things that attach your muscle to bone and bone to bone. Now, if you've ever gone to a doctor and they've done imaging like an MRI or an X-ray, and they've told you that your joints are perfectly healthy, they don't know what's wrong, the explanation might just be joint instability. Think of a ball bearing that doesn't have a tight fit. It might end up moving around too much and causing damage by hitting into the wall in different places. Yes, that can cause some damage in the joint, but a lot of times the pain that people are experiencing with hypermobile joints is just from the instability. And it seems counterintuitive, but strength training is actually how you fix that. Basically, it helps to tighten the joint down so there's less unpredictable movement. Hope that helps. Let's talk about hypermobility. Okay, so what is the difference between hypermobility, mobility, and flexibility? Flexibility is the ability of a muscle to passively get longer. Mobility is the ability of a muscle to actively move through a range of motion. Hypermobility is excess joint movement. This can happen one of two ways. It can be excess bony movement of the joint, or this can be the structural integrity and tightness of the actual ligaments. Ehlers-Danlos syndrome and joint hypermobility syndrome are actually very common comorbidities of ADHD and autism. These individuals may also have what's called low muscle tone, which is flexibility. A lot of their muscles will have more passive movement throughout the day. You can also have joint hypermobility and tight muscles at the same time. Oftentimes, people with hypermobility can have tight pecs or chest muscles and also tight hamstrings. This can cause very common issues associated with what's called upper and lower cross syndrome. The most common problems being lower back pain and shoulder pain. So what are some ways that we can combat some of these issues with hypermobility? Like and follow for a part 2. So let's keep talking about hypermobility, but now we're going to talk about back pain specifically. So first of all, let's talk about scoliosis. If you were like me and you're hypermobile or have EDS, you were probably diagnosed with scoliosis growing up. But why? EDS and hypermobility that's caused by weak connective tissue is going to affect the spine too. As you can see, there are actually a lot of ligaments that are holding each piece of your spine together. So if that connective tissue is weak, it's going to move around a lot. This is why being able to bend over and put your hands flat on the floor is one of the criteria. It's measuring your back hypermobility, not your hamstring flexibility. Another common cause of back pain is SI joint pain. This is the joint that joins your pelvis to your spine. Pain's gonna happen right about there. There are multiple ligaments and muscles that cross that joint, and if you strain the joint and move it in a way that it's not supposed to, it can cause a lot of pain, like when you're getting up from a seated position or bending over. The best way to alleviate pain from scoliosis and SI joint pain is to strengthen that area of your body. Like for part 3. If you're hypermobile and you have any of the following issues, loose kneecaps that track slightly to the outside, collapsed arches, and sleepy glutes, then listen up. I want to talk about how your shins might be the culprit. The main bone in your lower leg is your tibia. This should have the ability to rotate, particularly internal rotation when you're bending your knee. If it doesn't, it can cause ankle and arch collapse, kneecaps that track a little bit to the outside, and a lack of glute engagement. So what's the solution? Work on strengthening your tibialis anterior muscle. This muscle helps with that internal rotation, arch support, and also dorsiflexion of the foot. First, try this simple exercise. Pull your knee up to your chest. Try and engage that tibialis muscle and go between dorsiflexion and plantar flexion while keeping that muscle engaged. If you want to make it more difficult, practice that internal rotation with your foot and try doing the same thing. Another drill you can try is put a band below the base of your big toe, add a little bit of resistance to keep your foot planted, push your knee forward and out, and try and hold that for about 15 to 20 seconds. You should feel your shin turning on and also your glutes. If you already have squats in your toolbox, try practicing this internal rotation by pointing your toes more inward than usual. Even if you're only doing partial reps, you should be able to feel your shin turning on and your glutes engaging a little bit more.